Hi, my name is Dr. Jacobs. I'm a doctor of physical therapy, advanced clinical nutritionist, and inventor of ASTR. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. All right, Lolita, tell me what's going on with your hip. What happened?
Oh, I fell down in 2012. I hit my left
2012.
to 2012, yeah.
Yeah.
And
that's
then
8 years ago.
Yeah, I had a fracture in the two toes,
You did
the
fracture.
fourth and the
Okay.
fifth toes. Then I have a cast. I have
Okay.
a physical therapy.
Uh-huh.
The physical therapy helped.
Okay.
And then later on, I experienced having a lower back pain.
Okay.
My chiropractor did a X-ray, said that my lower back is bone to bone.
Okay.
There is no more cartilage in between. That's why the pain is radiating to my left hip.
Okay.
The pain is like 5/6, 5 to 6,
5 to 6
when
from
I'm
0 to
sitting
10
there.
the scale.
Yes.
What kind of pain is it? Sharp, dull, aching? How you describe it?
It's stabbing pain.
The stabbing pain. Okay.
Yeah.
Uh-huh. So this, like, for the last 8 years you have issue with your back, with your hip. What else? Briefly.
Right knee, it's hurting.
Okay.
And also my left knee is hurting.
Okay.
And then I have some numbness on my thigh and legs,
Okay.
some muscle cramps.
Okay.
And also my neck
Uh-huh.
is stiff.
Neck stiffness. Have you seen anyone else other than the PT and chiropractor?
I saw a orthopedic surgeon.
What
and
did he
the
say?
orthopedic surgeon told me I need a hip replacement and knee
Left
replacement.
hip replacement.
Here.
And which knee replacement he recommend? Left or right or both?
Right.
So he wanna replace your joint. Okay.
Yes.
All right.
I told him I don't want to do that. I want to
Mm-hmm.
try the PT first or something else.
Okay.
He's also recommending to have a steroid shot.
Okay. You had that or not?
I did not do it
Okay.
because he said it's not advisable for the hips.
For the hip. Okay.
Yeah, so I don't have any steroid shot
Okay.
yet, but I did not go back to the orthopedic surgeon
So you had the PT, chiropractor, any other treatments?
for almost 2 years.
Yeah. 2 years. Wow, that's a long time.
Yeah, and
you
then
had massage or anything else?
I do my body massage also, chiropractor like twice a week,
Okay.
and then I go to the exercise
Okay.
place. They are stretching it.
Okay. So your pain is it constant or comes and goes?
Constant, especially
Constant.
at night.
Okay.
I only sleep for 3 hours and
Okay.
then couldn't sleep anymore after 1 o'clock until.
Okay. What else is difficult for you because of your pain? We're gonna focus on your hip for now because our time, and then we're gonna work on the knee later. So
I'm having a hard time putting my socks on or lifting my left
lifting
knee,
your leg, like doing
like
this.
that.
Can
Yeah.
you do that? Can you lift it up?
That hurts.
That's very limited. Look at me. I'm lifting my legs up here.
I
My
can.
knee
I
closer to
cannot.
my chest.
I cannot.
See, just she cannot even do that. Okay.
Yeah, and
So that what else is difficult?
I have having difficulty going in and out of the car
Out of what
or
about
getting up
walking?
in the chair.
Sit or stand?
Yeah,
Yeah.
if I walk like maybe 100 feet
Mhm.
or I am on my feet for a long time, it's
Uh-huh.
starting to hurt more.
In the hip area.
Yeah,
You feel it in the joint or outside?
joint.
In the joint pain. Okay. So we'll have you stand up and walk and let me know from 0 to 10 how much pain, okay?
Okay.
So you give me numbers, okay? How much pain with that?
4, 6,
How long you been limping like that?
more than 6 6 months, I think.
Oh my gosh, sorry about that.
But-
That's not fun.
These last 2 months is getting worse.
Last 2 months is getting worse. Okay, so we'll have you walk back and forth here and tell me how much pain. You're really limping, and that's a very slow gait. So you are limping because of your hip or hip and knee?
I think mostly it's my hip.
So your left hip. Okay, we'll come back. And before this going on, you were walking a lot faster. Is that correct?
Yeah.
Okay. So we'll have you lie on your back. How much pain when you walk?
6.
6 in the hip, sharp pain in the hip. Okay. Fascial restrictions. It's like you're wearing a t-shirt 2 to 3 size too small. So it compresses on everything underneath it. And it could compress on nerve and artery and cause nerve pain. Is it too much?
No.
So you had physical therapy, chiropractor for several years. And we just had a few minutes of ASTR treatment. Can you tell any difference?
There's a big difference, Doc. The pain, there's no pain, just heaviness.
Heaviness because of
And
inflammation.
I can feel that I can walk better, and there is no more like limping.
Limping, so the limping decreased.
Yeah.
Yeah, awesome. Yeah, thank you so much.
You're welcome.
Okay, so today is your second visit.
Yeah.
Okay, so can you give us update? How's your knee? How was your hip? Was yesterday?
After the treatment yesterday, it's heavy, but there is no pain. Maybe the pain is only one.
Okay.
I can walk better.
Yeah, it used to
I
be.
can lift my feet a little bit higher.
But still feel weak.
Yeah, it's heavy.
Okay.
But last night I slept well because I feel the sharp pain like before. I can turn on the right and on the left. So I feel much better today because the hip is much better.
How about your pain?
Pain?
Oh, you're walking, I mean, sorry.
I think I walk more better. I walk straight.
Okay. So can you show me how you walk now? You definitely walk a lot faster.
Yeah.
Can you tell any difference in your limping?
I think I have less limping.
Yeah, so speed definitely a
And
lot faster. A lot faster.
Yeah.
And you're not as limping as
Not
much.
guarded.
Yep. So are you limping now because your knee or your hip?
Because of my right knee.
Okay.
And the buttocks is tight. My right
and
one side.
the right side we did not.
But this one, just a little bit of pain on the left.
Okay, can you lift your leg up and you can hold on the wall?
Here.
Where do you feel the heaviness? Just give me feedback.
Here, in the middle.
You feel heavy.
A little bit of pain, like one.
Okay, and this is the
Before,
one.
if I do like this, oh my God, it's very sharp pain.
You maintaining that. Yesterday was like.
Yeah, here.
Yeah.
And there's already pain, but here, there's no pain, just a little bit.
In the
like
front, not the back. In the front.
No.
Okay, so let's lie on your back again.
5, 6,
How's that feel?
7, a little bit of pain.
Okay, let's try it while the magnet right on it.
8.
Okay,
Put it here inside,
yeah. Just we'll leave it like this.
like that.
And try it and tell me if that's better with the magnet. Any difference
2,
with the magnet?
3, yeah. 4,
Feel it's a little bit easier. So she has a lot of inflammation, and
6,
when you have a lot of inflammation, it's like internal swelling.
7.
So it's actually in the way of her muscle to contract properly. Okay.
9.
Is it painful? Is it
Mm-hmm.
Okay, let's hold on that.
Still
Okay.
painful.
Okay, let me work on your back. Okay. Yep. She will need to use the Magna heel for longer time. So we will know today. If she get full range of motion after working on it and everything is fine, that's mild inflammation. If not, that's a sign of moderate to severe inflammation, so she needs to use a Magna heel on a daily basis until we get that inflammation down. Is that too much? Okay. Is it okay to work on your glute? Okay.
Window.
Okay. I'm gonna do something very interesting to see if the fascia tightness in the head affecting her hip. Okay. So after working just in here, we'll see her range of motion. Okay. If she did not get much mobility, I'm gonna work on the head now to see if the fascia restriction in the head affecting her hip, because the fascia layer wrapping the entire body, so it's an entire continuous system. It's not body part. So possibly the tightness in the head pulling everything toward that area. We didn't know until we tested, okay? She has a big scar tissue here in this spot.
Because I fell down on my right knee.
On the front or the back?
Huh?
Did you fell you fell on the front or the back?
My knee front.
Okay, so I can feel the really big.
And at the side of my hips.
Yeah. So before she comes here, she had a year of chiropractor treatment. And you had 2 months of physical therapy?
2 years of chiropractor.
2 years of chiropractor
2
treatment.
years of eating.
2 years. 2 years. That's a good business. Except not for a patient. Relax. Okay. So most of her scar tissue actually in the peroneus muscles and outside here. Here it's okay, except the kicking. Let's try to walk and tell me how that feels. So any difference after working now on it more?
This is better.
Where? The knee?
The knee.
Is it back to normal or you still feel a little bit...
Heavy.
Hmm?
It's better than before.
Okay. How is the limping?
A little bit.
Okay,
Not
let's
bad.
hold on the wall and try to lift this leg.
Here.
Okay, how's that?
Just a little bit of pain.
Okay. Okay, so let's have you... We're gonna work on your head and we'll see if that's gonna make any difference to the hip and the knee, okay? So, very obvious that in her head, the tightness, that's a sign that she has that area stuck in the proliferation stage. That's why when I released the scar tissue and the fascia restrictions, we went through the cycle very quickly to maturation stage, which back to normal with a normal range of motion. So we know this is proliferation, okay? We know there's inflammation here because I worked on her yesterday and she still have a limitation. The pain decreased, but we still have some limitation. So this way you will know which body part need more attention to work on with the Magna heel and which one is okay, seem to be normal.
Mm-hmm.
Does that make sense?
Mm-hmm.
Let's try to walk again. How is the other knee that we worked on?
The what?
The right knee.
The right knee is good.
Is it back to normal or you still feel...
It's just a little bit heavy, but there's no pain.
Okay. What about the hip?
The hip a little bit pain,
Okay.
not much.
Let's hold on the wall and try to lift it.
The hip
Yep. How's that?
up to here,
Yeah. There is a little pain.
there is a little pain.
Okay. What about the hip?
The hip a little bit pain, not much.
Okay. How's that? Yeah. Okay. How's that? Okay.
The hip up to here, there is a little pain.
Okay.
But it's higher.
You're going further higher up. Can you see that?
Before it's
The
only
correct
like that.
answer usually yes. Just so.
But this is higher.
Yes. You're moving a little bit faster too.
I know.
That's a very good sign. So let's have you lie on your back, head over your knee as far as you can. Can you tell a difference now? Bending compared to before? We should have did that.
Yeah. Oh, this one I did not bend it earlier. This one.
Okay. So you can tell from working on those several body parts, and I'm doing that purposely here to show you the difference between each body part in relation to normal healing cycle. So when the body part stuck in a proliferation stage, which is the second stage of the healing, it's easy with the tools to transition into maturation stage, which is the last stage of healing, which means going back to normal. But when the body part is stuck in inflammation, we have to get that inflammation down. If it's mild, a few minutes with the Magna Heal, and while we're talking, actually, we'll have you put the magnet on it. So this is a really good case of seeing different stages of healing and how the body responds to the treatment. So to treat inflammation effectively, we have to do nutrition evaluation. So we did that yesterday, and you are a nurse. What do you think about it?
Good.
The nutrition evaluation. Like,
I learned a lot.
from your experience, what did we find was missing? A lot of stuff.
Magnesium, zinc.
Yep. Mm-hmm. And enzymes. So, and you remember, I went over a slide with you, not with you in the video, but part of healing, you need to have zinc. You need to have magnesium. You need to have C. You need to have protein. You need to have D. So if you have D3.
D3. Active. What is that active though?
Well, that's my brand. It's the formula. It's yeah. So when you have deficiency like C, D, E, magnesium, zinc, those are required for normal healing. And if the person is not healing, we need to figure out which of those elements are deficient to really meet that deficiency. It doesn't make sense to take 20 supplements because you are guessing, because you don't know which one you are missing in your diet. It's not very advisable. So that's why we have to do testing and nutrition evaluation to figure out what is missing and meet that deficiency. The other thing that's more important when we do testing is we need to know, that's why we're running some labs, the dosage. So 2 people could have zinc deficiency. That doesn't mean both of them need the same exact dosage of zinc. Someone might need, I'm exaggerating with an example, 100 milligram of zinc. The other person just need 10 milligram. So the only way to know that through laboratory testing to figure out. Because if you have deficiency in zinc and your body need 100 milligram, this is too much 100 for zinc, by the way. So that's example, okay? If I give you 5 milligram and you need 100, is that gonna do anything?
No.
It's not gonna do much. That's why if someone is not healing and stuck in inflammation, we usually recommend we'll do telehealth, or if they come to the clinic, we'll do the nutrition evaluation to figure out why the body is not healing. What is missing and how much is missing. Because those are very important questions that determine the outcome. So, let's say if she deficient is zinc, back to zinc again. Hate that example, but I'll use it. She need 100 milligram, okay? That means severe deficiency that might take her several days or weeks to really kick up the dose, the level. So it depends also on the deficiency and how long it's going to take to meet the deficiency. Scenario like this, when you have bone on bone, we have to be aggressive on using the Magna Heal. She needs to use it on a daily basis. And if she decided to get the kit, she can continue working on herself at home, using the tool on herself. You had hysterectomy and a big scar tissue here. I worked on the upper part of it, but I want you to work on the whole scar tissue. Because that scar tissue on the stomach does this. Look here. What's happening in the back? Severe tightness. And if her scar tissue, because she has hip pain, pulling this way, what do you think you're going to pull on? Her hip. So we have to clear up all of that, so to give room for the hip to move. Because when you have a scar tissue or fascia restriction, it's like you're wearing a t-shirt 2 to 3 size too small. So you're really not having enough room to move. Okay, so the recommendation was total knee replacement, bone on bone.
8.
Okay, so we'll do the walking now.
Sure.
How was that?
Oh, good.
You're walking faster. Is that because you want to go to the bathroom, or you're feeling better?
I feel better.
Okay, so that's feeling better, not going to the bathroom. Suck your stomach in, look up nice and tall. Okay, just keep walking back and forth. And tell me, how is your knee now, the one we worked on? How's that?
Good.
So does that make sense? Your neck and your knee stuck in a proliferation stage, and the hip on this side stuck in an inflammation stage, which need a little bit more work.
More work on here.
Yeah, compared to
And a little bit here.
Yeah. How you feel? What do you think about ASTR treatment? So you had
The greatest.
Yeah, you had 2 years of chiropractor and PT.
Chiropractor.
Mm-hmm.
Twice a week.
Yeah.
It helps and then it goes back.
So it
The
was
pain.
It was temporary.
Temporary.
Mm-hmm. Okay. Yeah.
Because if I will not go, the more I'm hurting.
Oh, okay.
Yeah.
So you felt short-term pain relief.
Mm-hmm.
Yeah. Right. Awesome. I'm glad you're feeling better.
Thank you, doctor.
Thank you. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Call us today to schedule your appointment.